Hello and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. I'm your host, Jason Howland, and today we're talking about leg pain. Did you know it might be the sign of something serious in your arteries? Peripheral artery disease, also known as PAD, is arterial disease in larger arteries exclusive of the heart, upper chest, and brain. And here to tell us more about PAD is our expert, Dr. Philip Vuocolo. He is a general surgeon and vascular surgeon at Fairmont Medical Center, Mayo Health System. Thanks, Dr. Vuocolo, for joining us today on Speaking of Health.
My pleasure, Jason. It's always a pleasure to be here with you and help educate our community on what to look for and how to stay healthier.
Well, let's start with the basics on our topic, PAD. What exactly is peripheral artery disease? Well,
PAD is sort of the common name for a type of peripheral vascular disease, which is narrowing of the arteries, usually in the legs, but it can occur in other places as well. And PAD is sort of the common term, as I said, for specifically lower leg disease.
What are some of the common symptoms of PAD?
Well, that's a great question. Actually, one of the interesting things about this disease is about 80% of patients have no symptoms at all. The most common symptom is pain, usually in the calf muscle when one starts to walk longer distances or up a hill, for example. Other symptoms can include numbness, tingling, loss of sensation, and I guess those are about the 4 or 5 more common symptoms.
Does it affect a lot of people?
It affects about 10 million people nationally and about 20% of the people over age 70.
So quite a few.
Quite a few.
Quite a few. Is leg pain of PAD, is that usually felt in the same area of the leg then?
Well, the pain is perceived in the area that's susceptible to the reduced blood supply. Usually it's the calf, but it can be the thigh or the buttock or even the arms occasionally.
And some of those symptoms that you were talking about, they sound pretty serious and some not so serious, but when should you go to the doctor if you're having some of those symptoms?
Well, certainly if you have any leg pain that you can't really explain is caused by minor trauma or a cramp, anything unusual, you should certainly seek medical advice. As I said, a lot of these folks don't have symptoms, so what we really like to do is screen patients based on their risk factors.
What are some of those risk factors?
The biggest risk factor, the biggest single risk factor is smoking. Other risk factors include high cholesterol, high blood pressure, obesity, diabetes, and family history is very important as well.
Are there certain screening guidelines for PAD?
Yes, well, generally anybody who is over age 70 ought to be screened. As I said, about 20% of folks will have PAD over that age. If you're over age 50 with diabetes or high blood pressure, you ought to be screened. And if you're under age 50 with diabetes, obesity, or high blood pressure and a family history, you ought to be screened as well.
So what causes this disease? What exactly is it?
Well, it's a cholesterol or fatty deposition inside the arteries. It usually occurs at very particular places in the artery related to turbulent blood flow. So the higher the cholesterol, the higher the blood pressure, the more arterial injury occurs and the faster the deposition of plaque. As the plaque is deposited in the blood vessel, the vessel narrows, reducing flow to whatever muscles or whatever part of the extremity is supplied beyond the blockage.
You talked about plaque. What is plaque?
Plaque is a deposition of cholesterol-like fatty deposits. When they deposit and harden, we call it plaque.
So Dr. Vuocolo, we hear all the time, watch your cholesterol levels, and this is a prime example of why.
That's right, Jason. My patients often tell me not to tell them again to watch their cholesterol or to stop smoking, but those are 2 of the biggest risk factors for the deposition of plaque and the cause of peripheral arterial disease, or PAD. The cholesterol level in the blood will determine how fast plaque deposits in the interior of the artery.
So if you have peripheral artery disease, it can mean you're at risk for some pretty serious diseases, right?
That's right. The underlying illness overall is called atherosclerosis, and that really involves all blood vessels. PAD refers specifically to the extremity blood vessels, usually in the lower leg, but someone who has PAD will likely have heart disease, which is basically the same deposition of plaque inside the arteries that supply the heart muscle, and carotid arterial disease, or disease of the carotid arteries, which can lead to stroke as well. So they're at fairly high risk for other complications such as heart attack or stroke.
And when a person comes into you, you suspect they may have PAD. How do you, as a surgeon, how do you find out for sure?
Well, as a vascular surgeon, it's very easy based on a good history that you take from the patient and a good physical exam to tell that someone has vascular disease. The question really is exactly how bad is it and exactly where the disease is located. And to ascertain that, which we can get a hint of by the physical exam, we want to usually look to other methods of testing, usually non-invasive, which includes ultrasounds, measuring what we call an ABI, an ankle brachial index, to compare blood pressures at the ankle to blood pressures in the arm. Ultrasound is probably the first line that we would use, and then after that we can go to angiography, which can be either CT angiography or traditional catheterization type angiography, and there's some newer techniques as well which are fairly sophisticated.
So atherosclerosis, this constricts the blood vessels, right? So the blood is moving faster through the blood vessels?
Well, it doesn't constrict the blood vessels per se. What it does is narrow the blood vessel by the deposition of plaque. As the blood vessel narrows, and I tell my patients this is really just fancy plumbing, as the blood vessel narrows, the fluid or the blood will move faster to get beyond the blockage. So as it moves faster, when we image that blood vessel with what we call a Doppler signal or an ultrasound signal, we can tell the velocity of the blood flow, and that will in turn tell us roughly how narrow the arteries are.
So if someone, you've determined they have PAD, then what's next for that patient?
Well, actually, there may be nothing else to do. It may just be a matter of having the patient alter their lifestyle changes to get rid of the risk factors in terms of smoking, losing weight, exercising, reducing their cholesterol, watching their diet. So lifestyle change is an important part of treatment. Most people don't come to surgery. We only do surgery in very selected cases when the patient's limb is threatened or possibly gangrene sets in. We call that at-risk tissue. When the tissues are at risk for loss, then we'll be more invasive. But as I said, most folks require relatively conservative treatment.
And why can sometimes the limbs be at risk?
Well, as the blockage continues, eventually you can get to the point where you have essentially no blood flow to the limb. So other than the excruciating pain, the tissues cannot stay alive and can't fight infection because there's no blood flow there to bring antibiotics and white cells there to fight infection, and gangrene or a severe infection can set in. And that can actually become life-threatening.
And so what is the surgery that's performed?
Well, the type of surgery performed to ameliorate the problem with the blood flow, in other words, to get more blood flow to the limb, depends on where the blockage is and how severe it is and how many levels of blockage there are. And that can be very variable. Sometimes, unfortunately, we can't do surgery to get more blood flow there, and we end up doing an amputation, which is very unfortunate.
But there are some other vascular surgeries that you can do that can help the blood flow in those vessels, right?
That's correct. Once we have someone who has progressed to the point where their limb is threatened or gangrene is setting in, then we'll do more invasive procedures like an angiogram, which is an injection of dye into the blood vessel to see the exact degree of blockage and exactly where it's located. At the same time, we can do what's called an endovascular procedure, or from within the blood vessel, we can open up that blockage with either a balloon dilatation, a balloon and a stent, and now we have new catheters we can pass inside the artery through a very small hole, which can actually chew away the plaque and open up the blood vessel. That's called atherectomy.
So how small are these, or how large are these blood vessels? I wouldn't think this is pretty minute surgery.
It can be. The main blood vessel in the abdomen, the aorta, can be involved. That's about an inch in diameter. So it can be on big blood vessels like that, all the way down to 1 or 2 millimeter blood vessels at the level of the ankle or in the foot.
So overall, surgery, we don't want to get there. We want to stop this before we have to have surgery. What are some of the just day-to-day treatments patients can do that have PAD?
Well, one of the real important things for patients to remember that have PAD is they really need to alter their lifestyle. There's no way we can successfully treat PAD or prevent its progression if folks continue to smoke, continue to let their cholesterol get out of whack and be too high, not to exercise, to stay overweight, and to eat fatty foods. Lifestyle change is really the hallmark of treatment. Hopefully we'll never get to the point of surgery if folks can do that. While we can't reverse the plaque that's already been deposited, we can certainly prevent more plaque from occurring.
And are there certain foods that people should just shy away from, especially if they are definitely at risk of PAD?
Yeah, I mean, I think people are well aware that, bacon and eggs are not the greatest foods these days if one has high cholesterol. Really, it's about balance. It's about maintaining a healthy diet all around. It's okay to have bacon and eggs once in a great while, but you really should cut down on the fats, on the saturated fats, on the cholesterol-containing foods such as cheeses, eggs, high-fat meats, that kind of thing.
And the no-brainer is stop smoking if you're smoking.
That's the single most important thing to do. If nothing else, stopping smoking will reduce the likelihood that one will progress to surgery and/or amputation.
And what is it with smoking? What does it do to the body?
Well, smoking actually does a lot of bad things in terms of the blood vessels. First and foremost, it increases the rate at which plaque is deposited. It also causes injury to the blood vessels and makes the blood vessels less likely to heal. It makes the blood clot more, which also causes then, when you get to the point of reduced flow, it causes a higher incidence of clotting within that vessel. And then the last thing it does is cause constriction of the smaller vessels, which sometimes the patient with bad vascular disease has to rely on for blood flow to an extremity.
How about the difference between men and women? Is PAD more likely to occur in one of the two?
Much more common in men than women, but we also see a fair amount in women.
And why is it maybe a little more common in men?
Well, I think it's a little more common in men for a number of reasons. In general, the rate of smoking is a little higher in men, a little higher incidence of diabetes in men, a little bit higher incidence of high blood pressure in men, and a little bit higher incidence of high cholesterol in men. So all the risk factors are more prevalent in men, and it's hard to sort out in any kind of study, all those risk factors. If none of those risk factors exist, then essentially you don't get the disease to begin with, so you can't really tell whether a woman or a man is more likely to get it.
So what's the single most important thing to do if you think that you might have PAD?
Well, Jason, the single most important thing to do is to consult your physician and tell them you suspect you may have PAD based on leg pain or whatever other symptoms you may have, and have them do a thorough exam and history, and of course refer you to a surgeon if you need to be evaluated further. But that being said, if one suspects that, they need to immediately think about their lifestyle. If they're smoking, they need to stop smoking again. Exercise as much as possible, even though you may get the pain. And the pain of vascular disease is a very particular type of pain. It's pain that occurs when you're walking a long distance, and if you stop, it goes away and you can continue to walk. It doesn't persist when you're not active in the calf, and it's very reproducible. So that reproducible pain with activity is really the hallmark.
Well, unfortunately, that's all the time we have, but we want to thank Dr. Vuocolo, General and Vascular Surgeon at Fairmont Medical Center, Mayo Health System, for joining us today on Speaking of Health. It was a pleasure.
My pleasure, Jason. Always happy to be here and help our community become more healthy.
Have a great day, everyone, and be healthy.